Hello and welcome to another episode of Essential Implementation. How important are relationships when it comes to implementation? Well, find out more in today's episode where I interview Allison Metz, Director of the National Implementation Research Network based at the University of North Carolina, USA. Hello, Alison. Welcome to another episode of Essential Implementation. Perhaps you could start by telling the people watching who you are and what you do.
Hi, Christian. Thank you so much for having me. So I'm Allison Metz, and I direct a center at the University of North Carolina at Chapel Hill in the US called the National Implementation Research Network. And I'm also on faculty at our School of Social Work, and I'm a psychologist by training. Our center really focuses on using implementation science in the best ways possible to improve outcomes and to advance equity for the populations that we work in a range of service systems. We work across education, maternal and child health, early childhood, and child welfare. And I'm focused both on implementation research and implementation practice. And I'm looking forward to our conversation and maybe diving a little bit more deeply into implementation practice with you today. We have a study funded by the William T. Grant Foundation, which is a domestic foundation here in the US, so they do a lot of international collaboration, and they're really focused on studying the use of research evidence. This project we have has yielded some really interesting findings. So basically asking three things, what strategies are people using to support evidence use in child welfare systems? And what's been so interesting, and the answer to that question is that it's been really varied in people's responses. I always kind of joke, besides the ever popular needs assessment, there's quite a range that people say. I mean, people will mention fidelity monitoring, using data for improvement, but there was kind of a range in the strategies that people spoke about. And then when you ask them a question about how you engage stakeholders and how critical the engagement of stakeholders is to any strategy you're using, the answers became more similar. People talked a lot about the sequencing of that, how important it was to demonstrate value, to demonstrate credibility, to join, to actively listen. And so that was really interesting that there seemed to be more commonalities when people got to this piece around stakeholders. Then we asked some questions around how important are our relationships to the work of implementation. Mm-hmm. And Christian, it was basically like you could hit play, that people were saying such similar things. I mean, people were basically like, relationships are the foundation of this work. Mm. You need to build trust. Here's how you build trust. You demonstrate empathy, you demonstrate vulnerability, you demonstrate authenticity, you enter this implementation space with humility as a co-learner. You demonstrate commitment and resilience, because there's no question that implementation will have a set of challenges, and you demonstrate the ability to stay in difficult conversations, to stay in difficult situations, to name the adaptive challenges, not just the technical ones. And it was such, a master class, because when I was listening to these folks who provide implementation support, also do implementation research, as I said, it wasn't as if they weren't aware of the technical part of implementation, of the need to assess needs, to understand fit and feasibility, to try and garner buy-in, to develop measures of implementation progress, to develop fidelity monitoring systems, to develop communication protocols. Yes, these are all the things, but I think we've been talking about those things for some time now, and I think what we're not talking about are all the other things that folks mentioned in these interviews we did, which was about the relationships. And that's where it felt like a master class to me. It was like, yes, you can set up a fidelity monitoring system, But you need people to trust the process. You need people to trust the data. You need people to trust the selection of the intervention. And you do that by demonstrating all of these kind of relationship building skills. And I don't know, to me, that's often what we're not talking about. And one of the questions we had at the end of that I think is definitely researchable is building relationships a strategy, an implementation strategy, or is it a moderator? Meaning that whatever strategy you're using is more effective if you have a strong relationship. And you could go even further and ask, is the relationship more important than the specific strategy? Because there's so much in implementation now around this idea that there's a mismatch between the strategy and the implementation challenge. So we overuse strategies that we have comfort with, familiarity with, competency with, that are available to us, hence things like training. These things get overused because they're available, because we know how to do it. But they're not a match for the actual challenge. If the challenge has to do with lacking a shared mental model on what the problem was in the first place, something like that. And so there's a lot of discussion about that. But I think another layer of that discussion is, and this might be overly provocative thing to say, but is the strategy less important than the relationship? So if you are in a strong relationship and providing implementation support, is any strategy you use going to be more effective simply because people trust the process? So I think those are interesting questions that are answerable in some ways, maybe qualitatively, but I'm really curious about it.
What do you think the reason is there isn't more of that in the literature? Like, as you say, we have all these frameworks, we have all these approaches, we can put in monitoring systems and fidelity measurements, but because to me, it just seems like common sense. If you want something to be implemented, then get to know the people in the setting, get them to trust what you do and get them to understand, and you're going to get better results. But that isn't kind of so obvious in the literature. Why do you think that might be?
Because I think that there is becoming, and this is the greatest irony of all ironies, I do think there is a bit of a disconnect between basic implementation research and implementation practice. So, and I'll hopefully connect this to this question. But as someone who conducts basic implementation research, but also spends a lot of time in the field supporting implementation and uptake of evidence, my job when I play that role is to take evidence derived from implementation research and apply it in my practice. So if implementation research says that an audit and feedback is a really good strategy to use, then I can apply that in my work. But I think unfortunately that feedback loop has not gone full circle, meaning I think implementation research informs practice. I'm not so sure implementation practice informs implementation research. And this is what I think is happening. I think that a lot of people that are doing the on the ground work are maybe not necessarily strict academics. And I don't think are spending a lot of time publishing papers on their experiences in the real world. And I don't feel like they have a venue for where to publish those. Some of the people we interviewed talked about that. They have these amazing case examples of the work. Or if you think about in the US, the D&I conference or other big implementation conferences, they're really heavily oriented to research, and there's very little on practice in those conferences. And so I think what's happening is that the folks doing the work that know how critical relationships aren't finding a home to share that information as readily. And I don't think that feedback loop is as virtuous as we want it to be. I think that we're taking evidence from implementation research. I think implementation researchers need to inform their questions by those doing the work in practice. So I don't think they're asking questions about relationships or vulnerability, and I think that there are ways to ask those questions and to measure it. A really example would be a clinical measure, like a working alliance. Does a high, score on a measure around working alliance, is that correlated with stronger implementation success down the road? I think that and that's a really basic example, but those are the kinds of things that I'm super interested in. But I just think that feedback loop is not as strong as we want it to be right now between people who associate themselves in the field of implementation science, but are more on the ground, versus those who are in implementation science and predominantly doing research. I think you need both. And I think there's some examples where those conversations are happening. Like, I know some implementation researchers that are fantastic about engaging with folks who are providing that type of support every day. But for the most part, I think there's still a lot of gaps in those conversations. There's two types of people that I think need to be partnered with by researchers. One I just mentioned, researchers partnering with those who are delivering services or leading agencies that deliver services. And that's typically what's meant by research practice partnership. I'm also talking about the space in between that, which is what we do refer to as implementation support practitioners. Those are people like that work at intermediaries like NERN, like the Center for Effective Services, who are basically contracted with by a public system to help them implement something. So in many ways, we're the broker between implementation research and practice. And I think that there needs to be a stronger partnership between implementation support practitioners or professionals providing implementation support who are a big part of this system. And in the US, that's often falls under a umbrella called technical assistance, but there's a lot of funding for that. And a lot of that work is not done that well, and some of it is done well. And I think it could all be served better by stronger partnerships with researchers.
So there's actually a real need, a real place at that, and it's growing for somebody to be that intermediary. Because I mean, if you take an example of, say, auditing and feedback. Audit and feedback you can publish quite easily, because you could say, well, this is what it looks like, this is how it works, and this is what they need to do. But then you might, so then you might have someone like yourself, an intermediary, that and that knows some people in these contexts that actually get implementation done. And of course, it's probably quite messy, isn't it? There's millions of micro strategies that you probably have to do to get something done. But then that's a lot harder to publish, right, in a paper. So would you agree that's kind of the issue as well, that the kind of knowledge that intermediaries and practitioners have is actually quite hard to get down in a paper?
Oh, absolutely. Right, as you noted, the work is really messy. And you're often not entering the work with publication in mind. So that's also, I think, something that folks who are providing implementation support in this intermediary role need to get better at documentation and having some maybe more rigor to how things are documented and processed, so that it can be more publishable. But yes, I think that implementation research, there's something inherent in the work that I think thinks of implementation as linear, as rational. It is anything but linear and rational, because people are involved. And, people aren't always that rational. It's why we needed like the nudge theory in economics. It's people. How we make decisions is incredibly interesting and confusing. And I think that's why the William T. Grant Foundation has this entire body of work around studying choices around using evidence, because there's just so many other political, social, economic influences on how people make decisions, but also emotion. When you're implementing and doing something new, there's risk, there's feelings of loss and grief and change. There's team dynamics, group dynamics. When you bring a team together on a psychodynamic level, that alone is really fascinating. And so the people that provide implementation support are doing all of these things. They're managing group dynamics, they're facilitating, they're brokering connections, they're addressing issues of power. There's so much going on in that work that is not a single implementation strategy or even a package of strategies, which is like, it could be audit and feedback plus 5 other things. That is great, and it might be part of the work, but there's so much surrounding the work that relational in nature.
Yeah. Do you think that, say, because some behavioral psychologists would tell you that implementation is simply changing behavior. And if you just apply this, the TDF or, the behavior change wheel or COMBI, then you'll be able to change behavior and things will be implemented. Do you think that's a bit too simplistic? I know it's provocative.
Yeah, it is. It's like, so to me, it's kind of like a both and. I'm not just saying that to be diplomatic. I do find value in behavior change strategies. There's no question. I mean, there's little behavior techniques. I mean, I'm a psychologist, little hacks I use that I know can move something along, right? I also am a firm believer in protocols and in reinforcing things and labeling, when behavior is changing, and you're happy to see that. At the same time, I do think that it is psychodynamic in nature and incredibly relationship driven. And one of the things I've come to learn is that, are you familiar with the iceberg model?
No, I don't think so.
Okay, so it's basically just a way to describe kind of what's happening that you can see.
Okay.
And what's happening kind of under the surface, which is typically people's mental models. And we don't always have a shared mental model. So if you ever see a graphic of an iceberg on the I will say on the top, events, things above the ice, trainings, things you can see. And then you start to see below that patterns of behavior. And then as you get deeper, it's things like mental models. And what I've learned is that most implementation strategies that are currently talked about are the tip of the iceberg. They're above the waterline. And we are not getting at what's happening below the waterline. And that's where the risk, the loss, people's mental models, that's what's happening. And I think that's why there's such room for psychological perspectives on implementation. Again, it doesn't mean that I don't embrace the research, the theories, the models, the frameworks, the behavior change techniques. I've spent my career embracing those. But I have also spent my career engaging and empathizing and developing vulnerability-based trust and understanding that psychological safety is at the root of all staff change. And if you're not paying attention to those things, the behavior change techniques and the strategies won't yield sustained impact.
Yes. Yeah, I think that's fascinating. That iceberg beneath the surface, you call it mental models, but you've got instincts there. You've got real fundamental drives, and I think to ignore those is really you're not going to get the results you want. Yeah,
it's interesting. I mean, I kind of look back. There's a handful of projects, if you will, that have yielded population change, which is the hardest thing to get to, right? Because you're usually brought on board to help scale something, whether that's a model or a series of evidence-based programs and practices. I do most of my work in child welfare and early childhood. And I look at the projects that we have been able to attribute the new programs or practices and the scaling of them to some sort of population change. And you really only get a handful of those successes because there's so many reasons, right, why that may not happen. But someone once asked me this question, which is, why do you think those successes happen? Like, do you think it's the framework that you're using? Right. So like clearly our center has a framework that we use. I think it's very helpful, and then they ask me this question, or is it more the space in between, the relationship between you and the people you're working with? No one had ever asked me that before. And this is honestly, at this point, it could even be as much as 6-7 years ago. And I remember thinking it was such a hard question, but I thought it was the latter. I actually started to think, I don't know, I think it's the relationships. I mean, these are deep connections. These are committed connections. This is work that took 5 years, and there's been a lot of laughs and a lot of, unhappy times and things. And we've kind of stuck it out together. And I don't know, I couldn't underestimate that. And I started to think, that's when this interest in the competencies came in. Like, what are we doing? Like, I know we're using this framework, and I know I'm collecting these measures, and I'm sharing this data, and I'm building this team, and I'm building multi-level teams because we're trying to scale something. So I'm doing all these best practices, but what else am I doing? And I started to think about the fact that I was doing a lot of brokering. So when stakeholders could not see each other's point of view, I was doing a lot of work to develop people's sense of connection and empathy with another stakeholder group's point of view. It was the first time I realized that empathy is at the heart of implementation, that if stakeholders can't empathize with each other's perspective, it's hard to move it forward. Even if you're always going to have a bit of a different stake in the work or point of view or need to come out of the work and a different priority, all that's fine. But you do need to understand that someone else might have a different priority. So that's just one example of, I started to disentangle, what am I doing when I'm on site? If I spend a whole day and I fly somewhere and I'm in meetings and I'm meeting with parent advocates, and then I'm meeting with practitioners, and then I'm meeting with the commissioner of a 12,000 person system. What are those conversations I'm having? How are they different from one another? How am I being discreet in each of those conversations, yet strategic? Because I'm trying to kind of build a sense of connection across all of those players in the system. And anyway, I know I'm probably going on and on, but that's so interesting to me, is understanding what people do, which is why we developed this practice guide based on research, but also a lot of qualitative interviews that we're doing now, and truly understanding that what it takes to do this work. I think it is much more complicated than folks even maybe would estimate.
Yeah, I think the way I got to this point was, I was asking, the original question I was asking was, how can we make this academic knowledge practical? And I think you've kind of been answering that a bit today by talking about, well, it's the competency of the intermediary, and it's the relationships and the empathy they can build, and the brokering, because you know really well the academic stuff and the frameworks like the CIFA, but you're also going in, and as you say, you're creating relationships with these people and talking to them in certain ways. And do you think that's what brings the academic stuff alive and allows implementation to happen?
It does. I've spent a lot of time in my career. In the beginning, I used to think I had to train people on the frameworks so that they needed to understand, right? So I would come in with 50 PowerPoint slides and, walk people through the framework. But then I realized for some people in the public system you're working in, or the nonprofit, wherever you're trying to support change, some people will pick that up. And you're going to have this small percentage that's going to run with the CIFR and understand it. But a lot of people really won't, because they have day jobs. They have other things to do. And so I realized, like, something like the CIFR, which I love, and I think Laura Damschroeder's contributions to implementation science are, unparalleled. That is a diagnostic tool that I use. It's a planning tool that I use. And sometimes it may be shared with a small group who are interested. Other times you may be working with the team and you may never really train them on the CIFR. It's more that you're talking in their language, but in the background, that you've used a model or a framework to help with the diagnosis of the challenge, to help with the action planning, to inform the measures that you want to use and the data you want to collect. I think sometimes for us, that's people providing implementation support that's in the ground, which could be another reason that it's hard to publish, is because sometimes we're kind of holding that in the back, and that most of our external facing interactions are more plain language, or the language of those we're working with.
Yeah, I really can appreciate what you were saying as well about the sort of different groups or different stakeholders, and if they can't empathize with each other's view, then implementation's going to be a lot harder. The NHS is a big system, and there are lots of different stakeholders. Imagine you were working for the National Health Service here. You've been, maybe they brought you on and you'd kindly agreed to help, and so they wanted to roll out say a new exercise program for stroke patients across 20 hospital wards. What would be your starting point?
My starting point would certainly be how they came to that decision. So
right.
I think it's so critical that that the intervention that's being rolled out feels resonant to those who are going to deliver it and those who are going to receive it. So I would think about, and this is actually where kind of formal implementation training is helpful. You think of Enola Proctor's implementation outcomes and how they can map to stages of implementation. And you think about things like acceptability and appropriateness and some of those types of outcomes. I would be seeking to demonstrate that from the beginning. Another thing I would be looking really closely at is how well operationalized the approach is. We're often asked to implement things that are a little squishy still, and it's really hard to build infrastructure for that. So I would be focused on a lot of those emerging and early exploration activities, and seeking to ensure that stakeholders were engaged, that they are engaged, and that things feel acceptable and appropriate and resonant, and that we would have an ability to contextualize where needed. So those would be some of my kind of early starting points.
Yeah, and I think you already said that we're still working out whether that approach is actually an intervention in itself or a modifier of. I totally. I guess one question I could ask you is, do you think there's a risk at the moment as well of this kind of fast implementation where we say, well, we've applied these frameworks and we've ticked these boxes and we've done our implementation science, but they're not actually really increasing implementation, right? Because they're not kind of actually going and doing it.
Oh yeah, I mean, I think we need to study sustainability a bit more too, and understand kind of what's at the heart of that. I think often there's kind of programmatic sustainability and fiscal sustainability, but I think it's the strength of relationships, is what people say, sustains things. And what's interesting is this question about speed, because relationship building does take time. It's why you have to advocate with funders. People who we interviewed that play this implementation support role really lifted up this question of whether or not they're advocates as well, whether or
Mm.
not they have to advocate with funders, whether or not they have to advocate for populations who are often marginalized to be included in decision making, especially when those decisions directly impact them. And I think we do need to play that role of advocate as well, and that does take time. I think everything we do needs to be focused not just on better outcomes, but equitable outcomes. I think that we're struggling to still to sustain things, to sustain them long enough to get to impact, to have equitable outcomes, to reduce disparities in outcomes. And I think we just don't want to keep learning that same lesson over and over again, that it's part of our implementation methods. I think that are missing, the boat a bit in terms of kind of what we can do. The other thing I wanted to say though about speed that has been so interesting, and I think relationships are at the heart of this as well, is that with COVID, there has been some speedy implementation. So things that have moved from in-person delivery to telehealth to modifications that have been made to different interventions to how things are monitored. And I think this is a wait and see, right? I mean, we don't know what the impact of these both modifications to the intervention or service and then the modification to the implementation strategy. So for example, we may be training practitioners virtually now rather than in person, or we may be delivering an in-home service on Zoom. And we don't know what that will be, but so I can't make a judgment about that, but I can make a judgment that I ask some folks just randomly. There's nothing systematic in this little piece of information, but it was really interesting to me. I wrote a blog about it actually because it was so interesting. As I said to folks, how are these changes happening so fast? We're working in these systems that are so bureaucratic, and there's a practical reason why, because some of the bureaucracy, the conditions have been lifted during COVID so that people can do things more quickly. Money's pumped in, things like that. But people also said it was a shared sense of humanity. So that, for example, in our service systems in the US, our large public systems are at least partially privatized. So that will mean that, for example, like a public system in child welfare maintains custody of children in out-of-home placement, often delivers case management to those families. But specific behavioral health or mental health services would be delivered through a private service provider network. Often the relationships between the public agency and the private service providers can be strained. They can be strained because the system has a lack of resources, because it's hard to improve the lives of children and families. And so it's kind of, or is everyone doing what they should be doing? During COVID, those historically strained relationships, they were working seamlessly together. It was like you called someone and they answered the phone immediately and said, "How can I help?" And I have to say, like that, I don't think you can create these conditions, nor would we want to create catastrophes for people to have this shared sense of humanity. But it did show me again that at the heart of this, there was a relational piece.
Yeah, I spoke to Michael McCoo, who's an ICU consultant at the hospital where we work, and he said a similar thing, that during COVID, there was less bureaucracy, and what would take them 2 weeks or 2 months to get, say, 15 new beds, they did in 2 days. And I was quite pleased that the executive I spoke to also agreed that there's probably a sweet spot somewhere in that, between too much bureaucracy and perhaps too much freedom.
Yes.
But you're the first person to talk about this sense of humanity, and I think that's it's really interesting. And again, do you think that's coming back to those relationships again, and that's empathizing and actually connecting as humans rather than just following, I suppose, kind of a protocol or.
People often feel blamed.
Mm.
When there's a critical incident, the first thing that happens is someone is blamed rather than understanding where the system failed, because we're just working in these large systems, So this intersection between psychological safety, implementation science, I think absolutely needs to be explored. And I was mentioning to you in the beginning that we run these virtual institutes on implementation science. And this spring, I want to bring together folks on this topic of psychological safety and implementation, because it's almost crazy that we enter into implementation without, we do all these assessments of readiness,
Yes.
buy-in,
Yes.
but we're not assessing whether or not this system is traumatized, whether or not the staff in the system feel safe to ask a question, to admit a mistake, and we need to know that as a baseline measure. You know what I mean? And we're not measuring that at baseline for implementation. And I just want folks who work in systems like child welfare to talk about what it means to support implementation in those systems through this lens that you and I are talking about now. Because I think we need readiness measures and all that good stuff, but again, we're missing this human piece to it. And I hope that as implementation practitioners, we start to measure, because there are measures of psychological safety, organizational measures. And I think we need to start bringing that into our work.
This idea of psychological safety is fascinating. Let's back with that example we brought up before. Imagine actually, these 20 wards had really wanted this thing to come in, and so you're going to take it in, roll it out. But would you use a psychological safety? Would you be thinking about that when you're working to help them implement things?
Absolutely, because you want to make sure you're implementing it. If you think about hospital settings, healthcare settings are some of the most hierarchical settings, where depending on where you are in that, you feel less safe to make a mistake, to share an opinion, to ask a question. And it's probably one could say why there are challenges in these systems is because people don't feel like they can kind of say, I don't really understand that. And so, yes, I think we would want to understand in those hospital or healthcare or facilities that this was being delivered in, rehabilitation facilities, how safe their practitioners felt, because it's often the folks who would be delivering the intervention that may feel the least safe.
Yes.
Versus folks who are managers or leaders. I've become really interested. This concept it's some people refer to it as safety science, or it's around in industries that have critical incidents, like in the airline industry, for example. Like when they experience a crash, it's not blame the pilot, it's what happened, right? And they do a massive kind of systemic analysis of what happened. For some reason, our systems don't do that. If we have a critical incident in child welfare, it becomes very much about blaming a person rather than understanding the system. And I think applying that is so important. And there's some studies. There's a book, I have it around me, The Fearless Organization by Amy Edmondson, and she's a professor at the Harvard Business School here in the US. And she did a lot of studies of corporate US, like Google, and kind of what was the kind of common thread in highly functioning teams at work. And it was this feeling of psychological safety, of not worrying about embarrassing yourself. It's essentially, feeling like you can take a risk, feeling like people have your back. And I think a lot of our service systems don't feel that way.
Absolutely. That's really become clear in my time with the Improvement Academy.
If someone feels heard, they're driving it, the supervisor's creating a safe container for the work. That is the ultimate in kind of coaching and reflection, right? That is different than coaching someone to achieve a certain score on a fidelity measure. But you kind of need both, right? You need that psychological safety, and then there's the practical part of me that's like, well, it's still an evidence-based program. It's demonstrated efficacy. We want to kind of follow this.
Yeah.
How do you bring the two together? And I started to try and work that out. So it's this integrative part of my own practice that I've become the most interested in the last couple of years.
So there you have it, folks. Allison Metz on the Essential Implementation podcast. Hope you enjoyed it, and we look forward to seeing you next time.